The vast majority of outer hip pain is caused by gluteal tendinitis, which is normally very hard and slow to improve. But the biggest research ever done into gluteal tendinitis shows that one treatment can improve it by 77% in 8 weeks. So today I'm going to show you how to do that at home, and then show you another research-proven method you can use to double that rate of improvement. The famous LEAP trial into hip pain showed that you can improve gluteal tendinitis by that 77% in 8 weeks by doing a combination of two things: avoiding tendon compression and surprisingly easy exercises. Avoiding tendon compression is quite simple. Just avoid moving your knee across the midline for long periods, because this compresses the tendons against your hip bone. So don't stretch your gluteal muscles, don't cross your legs, and don't stand on that leg with your hip right out to the side. To sleep, just lie face up or lie on your good side with a pillow between your knees. The exercises that were successful in the LEAP trial were ones that strengthened the tendons of gluteus medius and minimus. So here's the easiest way to do that in a way that best mimics the natural action of those muscles. Stand in front of a sturdy rail or sofa, put all of your weight onto the leg of your painful hip, and put your other leg out to the side so the tip of your foot is just touching the ground. Adjust your hip position so that your hip isn't sticking out to the side. Then with your fingertips on the sofa to steady yourself, try to hold that position for 30 seconds. To make it easier, put more weight on your other foot. To make it harder, tilt your body more to the side so that your pelvis tilts up more. Then change position, and with all of your weight on the same leg, tilt forward slightly with your other foot behind you for another 30 seconds. To make it easier, put more weight on your other foot. To make it harder, tilt forward more at the hip. Repeat both positions so that you end up doing each position twice for 30 seconds with 2-minute breaks. The key here is to adjust the difficulty to make this challenging but not too hard on your muscles and tendons. When your hip becomes pain-free, don't stop doing the exercises. Continue for at least another 8 weeks. But instead of just holding the position, begin to add some very slow movement. Tilt your body to the side so that your pelvis slowly lifts up on the other side, going up over 4 seconds and down over 4 seconds. And then do the same, tilting forward, tilting at your hip, not your back. You can use your fingers to gently steady yourself, but try to control most of the movement with your hip muscles. Now, Professor Keith Barr, a world-renowned tendon specialist, has discovered a way that you can double the rate of healing, double the rate of collagen synthesis in your tendons by doing one thing. Dr. Barr's research shows that if you increase the amount of collagen that you have in your system at the time of doing the exercises each day, more collagen is absorbed into the tendon, speeding up tendon healing. So take 15 grams of hydrolyzed collagen plus 50 milligrams of vitamin C to increase absorption 1 hour before doing the exercises each day to maximize the results. These tendon supplements are often found together, but just be sure that the source of the collagen is from animal skin sources, not bone, because bone sources have a lot of heavy metals in them. Hip pain can come from a combination of things: the tendinitis, but also muscle knots, arthritis, and weakness of the surrounding muscles. So if you want to cover all of these things in a quick routine that you can do at home, check out the link below to my hip workshop.